faithfully delivering value, exploring global literary works. Hi, this is Sally's Book Club. Today we're diving into the Aspirin Chronicles. Authored by British journalist and TV producer Jeffries, aspirin is a WHO recognized essential medication. Many remember childhood fevers where parents would give aspirin, saying, sweat it out after taking it. Beyond fevers, elderly care context. Now take enteric-coated aspirin daily to prevent thrombosis. Given its ubiquity, just how much aspirin do we consume? Global annual consumption reaches 40,000 tons. That's 50 to 120 billion tablets. Even in mass production pharma, these are astronomical figures. How did humanity discover this wonder drug? Why does aspirin have such diverse applications? The Aspirin Chronicles holds answers to these questions. Let's explore the book through 4 key perspectives. First, the birth of aspirin. Second, aspirin's globalization journey. Third, how aspirin impacted World War's outcomes. Fourth, from fever reducer to cardiovascular guardian. Let's begin with aspirin's origin story. The humble willow tree holds the key to aspirin's birth. Acetylsalicylic acid, aspirin's chemical name, derives from salicylic acid in willows. Without ancient knowledge of willow's medicinal properties, aspirin wouldn't exist. Willow's medicinal use dates back to Sumerian civilization 6,000 years ago. The Sumerians flourished in Mesopotamia, present-day Syria and Iraq. Hippocratic texts from ancient Greece document willow bark's pain-relieving properties. With the continuous spread of ancient Greek civilization, by the late Roman Empire, willow became one of the most common remedies in the Greco-Roman world. After Rome's fall and through the Middle Ages, Greek medical knowledge faded, willow remedies were forgotten. In the 1760s, the English rediscovered willow's medicinal value, a milestone in aspirin's history. This brings us to Edward Stone, an English country clergyman. One riverside stroll, Reverend Stone curiously chewed willow bark. A fateful moment. The taste reminded him of cinchona bark used for treating fevers. Febrile diseases then included malaria, influenza, headaches, any feverish condition. Cinchona trees grew only in Central America. Their expensive imported bark was unaffordable for most. But willow trees grew abundantly in England, their bark having similar bitterness. Stone hypothesized willow bark might treat febrile diseases too. Testing his theory on fever patients yielded remarkable results. His report to the Royal Society was published in Philosophical Transactions, read by Newton and Franklin. Within 20 years, willow bark remedies spread through Britain and continental Europe. During the Napoleonic Wars, early 1800s, British blockades made cinchona bark scarce in Europe. Meanwhile, experimental chemistry made significant advances. Scientists began extracting active compounds from natural remedies like cinchona bark for mass production. In this process, European willow bark became a research subject as substitute for imported plants. Starting in the 1820s, salicin was extracted from willow bark, then further processed into salicylic acid. These active compounds showed medicinal potential, but severe side effects, particularly throat and stomach irritation, limited their use. Patients often refused second doses after initial discomfort. In 1853, French chemist Charles Gerhardt first synthesized acetylsalicylic acid to address these issues. This compound closely resembled modern aspirin's composition. However, primitive lab conditions made synthesis difficult. Low purity and lengthy process led Gerhardt to abandon research. Had he continued, aspirin might have been developed decades earlier. The real breakthrough came from Friedrich Bayer und Co., predecessor of pharmaceutical giant Bayer AG. Originally a dye manufacturer, Bayer possessed chemical expertise crucial for drug development. This foundation enabled their pharmaceutical expansion. In 1997, Bayer chemist Felix Hoffmann perfected acetylsalicylic acid synthesis using prior research. Post July 1899, production yielded excellent clinical results. Bayer executives then branded it aspirin for market release. The name combines A with acetyl and spire with spirea plant with pharmaceutical suffix -in. Spirea shrubs provided alternative salicylic acid sources. Thus, aspirin joined penicillin and Valium as legendary medications, gaining rapid popularity with 160 supportive studies within 3 years for treating various pains. As praise for aspirin grew, so did global demand. Bayer soon received orders from Germany, Europe, and worldwide. Pharmaceutical monopolies generate extraordinary profits. Common industry knowledge. Profit motives often lead companies to suppress competition, even with inferior drugs. This reality was depicted in the 2014 Oscar-winning film, Dallas Buyers Club. The film portrays a U.S. pharmaceutical company monopolizing AIDS treatment through FDA approval. The protagonist resorts to importing unapproved medications for survival. He later establishes a buyers club distributing smuggled effective drugs. Ultimately targeted by pharma interests, his operation gets shut down. This conflict between medical ethics and profit motives remains acute. When aspirin launched in 1899, Bayer aggressively sought patents to monopolize this revolutionary drug, but their patent efforts failed spectacularly. Had Bayer succeeded, would aspirin have achieved its global impact? This leads to part 2 of the aspirin saga, how aspirin became freely available worldwide. A history of global expansion through failed patent litigation. Early 20th century patent laws varied nationally. Bayer first applied in Germany, their home market. Patent examiners rejected claims due to prior synthesis records. Though improved, Bayer's process wasn't deemed novel enough. Most nations shared this legal interpretation. Only Britain and America granted limited patents. These two nations offered vast pharmaceutical markets with enormous profit potential. Bayer's celebration was short-lived, as German rivals flooded markets with their own acetyl salicylic acid products. Aspirin's first patent war erupted in Britain between Bayer and Hayden Chemical. In 1898, Bayer secured UK patent by claiming acetyl salicylic acid as new substance. This granted exclusive UK sales rights, including all British colonies. British patent law extended protection across colonial territories. The sun never set on British Empire's vast colonial network. Colonial monopoly promised astronomical profits for Bayer. Hayden Chemical quickly replicated acetyl salicylic acid synthesis. Profit motives drove Hayden to challenge Bayer in UK market. 1905 court battle. Bayer accused Hayden of patent infringement. Bayer's lawyers presented identical samples from both companies. Hayden admitted product similarity but challenged patent validity. Crucial argument: Bayer falsely claimed substance novelty in patent. Court recognized multiple contributors to acetylsalicylic acid development. Bayer's rebranding constituted patent fraud, court ruled. This decisive ruling stripped Bayer's UK patent rights. Following UK precedent, US revoked Bayer's patent in 1909. America followed Britain in rejecting patent claims. Thus, aspirin became globally unpatentable, but US courts granted grace period until 1917. Bayer rushed US production to maximize pre-expiry profits. Then came World War I's seismic shift, 1917. US entered war, establishing alien property custodian. German-owned Bayer assets became prime targets. 1988 armistice saw Bayer's U.S. assets auctioned to Sterling Drug. U.S. strategic reasoning became clear. Warring nations blocked German aspirin exports as strategic material. Post-war economic strategy: break German pharma dominance. Sterling acquired rights to use Bayer's name and trademarks, but lacked technical capacity for mass production. Sterling's William Weiss sought Bayer's technical assistance. After 5-year negotiations, a deal emerged. Sterling paid substantial fees for exclusive regional rights. Territories included Americas, British Commonwealth nations. Restrictions barred Sterling from other markets. Profit sharing favored Bayer significantly. Bayer technicians finally transferred production know-how. Though restrictive, this gave U.S. aspirin manufacturing capability. Germany's aspirin monopoly was effectively broken.